All right. Over the past several months, we have focused on the pandemic and vaccinations, but today we want to highlight another official need in our city. Blood donations are critically needed now and throughout the summer to ensure the availability of all blood types for patients that find themselves in need. As the city resumes some level of normalcy with progress in our battle against the pandemic, the hospital's demand for blood is increasing. And that is why I'm joining Chief Medical Officer Dr. David Pearce and the Gulf Coast Regional Blood Center to urge eligible health individuals to make an appointment to donate blood today and throughout the summer. In fact, Councilmember Kuvash is providing blood right now as I speak. Doing so is essential to the availability of the blood supply, which ensures life-saving medical treatments are not delayed for patients in need. In the summer months and with school out and many businesses still working remotely, blood donations tend to dwindle. This creates a shortage in supply everywhere, including here in Houston. And that's one reason I decided to host a blood drive today at City Hall. In fact, one of my directors has been hosting blood drives for the last 7-8 years, Janice Weaver, 8 years. And so this is just furthering what we have been doing here at the city and what people like Janice Weaver has been doing in her own right. With the largest medical center in the world, it's vital we have enough supply for everyone who needs a blood transfusion. You never know when you will be the person in need, so you should donate when you can. And finally, I want to say that as mayor, I have encouraged people to get vaccinated against COVID-19. So it is important to note that individuals who have received a COVID-19 vaccine can donate blood as well. Donating blood after receiving a COVID-19 vaccine does not reduce a donor's protection from the virus, and it does not hurt the recipient of the donation. In a moment, Cameron Palmer with Gulf Coast Regional Blood Center will tell you how quick and easy it is to donate. First, let me call up Dr. Pearce, the Chief Medical Officer and EMS Director for the City of Houston, to explain why donations are so critical during the summer. Dr. Pearce.
Good morning, and thank you again, Mayor. So, as the Mayor said, summer is upon us, and this is a time for family gatherings and for us to engage in summertime activities, and that's good. It's also a time, unfortunately, when things go wrong, when people get into accidents, and some degree with us coming out of this pandemic, we've had cases of people who are getting a little bit overzealous in some of their activities. We've had some serious car accidents, we've had shootings, we've had other things happen that people wind up in the hospital and they need blood, and they desperately need blood. There are situations when people can have catastrophic medical events, whether it be a car accident with a bad pelvic fracture, a gunshot wound that damages the liver, or the main vessel coming off the heart, the aorta. As we get older, a lot of folks have aortic problems, and when they start to bleed, those patients can sometimes require, and I'm not making this up, those patients can sometimes require as much as 100 units of blood to survive. 100 units of blood. So that blood has to be there for those folks. And these are survivable catastrophes if we have the blood available. In addition, on top of that, coming out of the pandemic, there are a lot of elective surgeries that were postponed. And elective is a relative term. For the patients who are getting the tumor resections that they should have had 6 months ago, these surgeries are very, very important, and they're going to need blood. For all the other types of surgeries that have been put off, and the problems are a little bit bigger now, and the need for blood, the need is now. We cannot wait for those folks. They cannot wait much longer, right? They've already waited as long as they possibly can. We need to get these surgeries accomplished, and the blood needs to be there so that they can be done safely. In addition, all of us love our families. Well, in order to have a family, there has to be a mom, and there has to be a baby. And sometimes during delivery, things can go wrong, and there's a need for blood during those situations too. So there are many, many, many situations for which we need blood, and sometimes it's large amounts of it. And so one of the things I want to point out is that, we do have a blood drive occurring right here, right now, just feet off the side of the stage here, that's co-sponsored by the Houston Health Department and the Gulf Coast Regional Blood Center. And I will tell you, I gave blood just yesterday, actually. And so, putting a little bit of the rubber meat in the road, and putting my money where my mouth is, whatever you want to say. So I gave blood yesterday. And every one of us is a source of good, healthy blood. And so let's go ahead and donate the blood And maybe, hopefully it won't be your family, but if it is your family member that needs it, then thank God the blood is there for them. Mayor.
Thank you. Thank you, Mr. Mayor. Thank you, Dr. Pierce. My name is Cameron. I'm with Gulf Coast Regional Blood Center, and we are part of our community healthcare system. We supply 170 hospitals in a 26-county area with blood and blood products. Now, this year, we actually have seen a record number in donor turnouts, which is absolutely incredible, and we can't thank our community enough for coming out and supporting us. However, like Mayor Turner said and Dr. Pierce said, we are in critical need of blood right now. As summer gets in, the pandemic, we're slowly recovering from the pandemic, and the roads are getting busier. We are seeing that influx in blood usage in our hospital. It's hurricane season, and everybody knows how unpredictable hurricane season is and how unpredictable that our Houston weather is, and we need to make sure that we are prepared in the event of a hurricane and we have to shut down for our collections. But we can't do this alone. We do need help from support from our city leaders and from our community, and we're asking our community to come out and donate blood today. Blood is a very easy process. Once you find one of the locations, it's just a quick eligibility questions, a quick health exam, and then you get put in the chair, you get sanitized and sterilized on the donation site, and just a quick stick, and you are saving lives in our community. Before you donate, please remember to drink plenty of water, get a good night's rest, eat before and the day of your donation, and please bring your ID. You will need your ID to donate blood. Also, if you have received the COVID-19 vaccine, you are eligible to donate blood. So you can donate if you've had the COVID-19 vaccine. And if you want more information, please visit our website at giveblood.org to find a location near you. And let's get out here and save some lives because our community really needs it. Thank you.
And then just to put a real face to what we're talking about, Janice, why don't you come up and just say how many pints of blood, I guess you would say, that you received, if you don't mind telling just to bring it home.
Yes, sir. So, first of all, thank you, Mayor, and thank you, Houston, first of all. So in 2013, I suffered a rare blood disease, and as a result of that, I needed a blood product, which was plasma freeze, and saved my life with over 500 units at that time. And so it's very important, and this is the reason that I do give the blood drives, because it is the way to pay it forward and to give back. And the thing about it is that you never know. And as Dr. Perk said, gunshot victim, car wreck victim, which is the condition that my body was in, and you just simply never know when you might need it. And so thank you, Mayor. And we're going on tour. It's what we call it, a blood drive tour, which is very important. So thank you so much. I appreciate it.
And Chief Pena, did you want to add to this? Chief Pena of the Fire Department.
Thank you, Mayor. I just want to echo the call for our community to get involved and get engaged and donate blood. Tragedies can happen at any minute. What's happening in Florida right now in Surfside, hopefully that doesn't visit any other community in our nation, but we never know. And the fact that we have a critical shortage of blood supply in our country is just something that we can do something about. So I encourage our communities to do a little bit of their part. 1 pint of blood can save 3 lives. So it doesn't take much of an investment of time to help your community to ensure that we have a life-saving product in case of an emergency. So thank you. Thank you, Mayor.
And again, I want to reiterate, you can give blood today at City Hall in the Legacy Room. One of the council members doing it right now as we speak. So, and I think we'll be here until noon. Or if you're in line, we don't leave. We're just like voting. We don't leave until you get it in. Okay. So, having said that, we'll pause, and if there are any questions, either of these individuals can respond. Okay.
Dr. First, about 3 questions here from the pool. How worried are you about the spread of the Delta variant in our area right now?
Well, first of all, let me point out, it's my job to be worried, and I am. The Delta variant is absolutely here in Houston. We've first detected it, I want to say, 6-8 weeks ago, and we've seen what it has done in other communities. So it has been at a very low level up until about now, but it is absolutely here, and there's no reason to think that it won't behave like the other variant, like it has in other communities. So far so good, but we now keep a really close eye on it.
With about half of the Houston area vaccinated, do you think we're in a good place right now, or where would you like to see the numbers?
Well, we'd actually, so where we'd like to see 100% of people vaccinated, obviously, right? But we really need to have, in order for the herd immunity effect to take impact and really slow down the spread of any virus, depending on how easily a virus spreads, that number needs to be higher. Now, the one thing about the Delta variant is it appears that it is about as 50% more easily transmitted than was the Alpha, or previously known as UK variant. That was about 50% more easily transmitted than the original. So this transmits a lot more easily. And every time a virus gets that ability to transmit more easily, the percent of the population that needs to be immune goes up in order to slow it down through herd immunity, right? So we had been saying with the Alpha/UK variant that we needed 70+%. I haven't heard the number for Delta variant, but since it's gone up another 50%, it wouldn't surprise me at all if the new estimate's going to be somewhere in the 80% of the population will need to have immunity. And you get immune one of two ways. You can either get immune by having contracted the virus and gotten sick with it and developed some of your own herd immunity or some of your own natural immunity, or getting vaccinated. But far and away, getting vaccinated is the way to go, because if you become infected, while a lot of people are having minimal symptoms, a lot of people are having sick. We're finding about a third of people that are getting sick with it are having the long haul symptoms. This virus, let's remember, this is not the cold. This is not the flu. This virus has thrown every curveball at us that we can imagine. 40% of the people who are infected have no symptoms, yet they're able to spread the virus. The remaining folks who become symptomatic have this wide array of symptoms. They're not consistent from one person to the next. So this is a very devious virus, and it will find any crack in our armor it can, and it continues to do so.
And last question, what are your thoughts on booster shots, and are they needed for people that have been vaccinated?
So at this point, it appears if you're fully vaccinated, and let's also remember, we have a large percent, about 10% of the people in the community here in Houston who got their first shot didn't get their second shot. So we still have a lot of folks out there that need to go and get their second shot, particularly with the Delta variant. In the UK, Public Health England found that the folks who were fully vaccinated were well protected against the Delta variant. The folks who only had one shot were very poorly protected. They had some protection, but it was very weak protection. So go and get your second shot. And I'm sorry, I forgot what the part of the question was.
It was about the boosters.
The boosters, right.
They're going to be needed.
So at this point, it appears if you're fully vaccinated, it does not appear that you need a booster. In fact, just last week, some data came out where they looked at bone marrow samples from folks, and they're beginning to predict now that if you got vaccinated with the mRNA vaccines, the Pfizer and the Moderna. Now, they've not done this investigation with the J&J yet, but with the Pfizer and Moderna, that you've got the cells in your bone marrow that may actually give you very, very long protection, years of protection. So that just came out last week. That needs to be verified. So at this point, it doesn't look like, for most of us, the booster is needed. But there is some research out now that people that are severely immunocompromised, people who've got immune system problems, whether it's because they're on chemotherapy or because they've got primary immune system problems, that they may need a booster. That is also just coming out now, and it needs to be further evaluated. But we'll wait and see what the recommendation is with that. Okay.
One last note, the July 4th weekend is coming. No celebratory gun firing, okay? So let's keep the guns where they need to be. But no celebratory gun fires, shootings, well, at any point in time, but certainly over this weekend with 4th of July approaching. So we will have people out patrolling, and you don't want to get a ticket, okay? You don't want to do that. So no celebratory gun firing, and please be safe over the 4th of July extended weekend. And I think that wraps it up. Anything else? Director Williams, you have anything that you want to add? Over there, mask up, okay? All right, okay, and get your vaccine, and get vaccinated, okay? Give blood, get shot, and get stick. Oh, I like that. Oh, get shot and get stick. Oh, SNS. Oh, They're telling me stage right. Okay. Okay. All right. Sherry gets shot and gets stick. All right. I like that slogan. You know, I can turn that into some rapper lyrics. You know. All right. I'm done.